So could they be wrong? Americans' assessment of their own mental health among those subgroups. Now, we want to see, right? Where's this data? We know it's Gallup. Look at that time period. Okay, we've got 2022. So U.S. adults, how would you describe your own mental health or emotional well-being at this time? Would you say it is excellent, good, only fair, or poor? So look at the dark green, and then we're going to contrast that with the poor. And this is amazing. 31, excellent. That's great. 7% are poor. Now, let's move just a little bit, only fair, and then good. So good kind of should be the largest, because that makes sense. Because, if we look at the normal curve, right, we see that it would be like this. This would be skewed, certainly. But that kind of meaty part of the curve, good. You have good mental health. That's great. Here's the thing. The 17%, I believe, the people that have fair, that they know there's a problem. That could be that sort of contemplation. We talked about stages of change earlier. Contemplation could also be preparation. Something's wrong. I don't know. Should I go talk to somebody? Should I maybe talk to my doctor about medication? What should I do? These are folks that still have that energy maybe to push back on it, who can still have pretty impactful change. Yeah, they can still engage in pretty impactful change in behaviors in order to attenuate some of that depression. What about that 7%? These are the folks, I think, that have that socioeconomic dysfunction, a pretty significant impairment related to their mental health, and that need us, maybe don't have the energy to reach out. So how do we do that? And that's what, my YouTube channel is all about. I encourage every mental health provider to put out research-based, honest, clinical information in your area of specialty, because that's what these folks are looking at. Because sometimes they can't afford us, but we can put information out there to help people. And that 7%, sometimes we can give them a strategy that encourages them to reach out for help in various ways in their community, or through insurance if they have it, or whatever it may be. We got to tap that 7% really needs us. That 17%, they're kind of wavering a little bit, right? But they have the energy to come and see us. So that's great. When we look at men and women, 36, 28, all right, pretty good percentage. 5 and 8%. We see that women are reporting about 8% poor, 20% fair, men 14% fair, right? And 5% poor. Look at the age range. Now let's look at the age range. We're just going to look at the fair and the poor here. Look at the fair and the poor for 18 to 34. Notice that's the biggest group, right? That says a lot. This is a generation that is struggling. And they're struggling particularly because I believe, and please tell me if you think this is wrong or if you want to add other components to it, but I think they're struggling with a sense of self. And I think for individuals that have an unstable self-image, and I know that that's a BPD criteria, I'm not saying everybody has BPD, I'm not saying that at all, but I see a lot of folks, so my kids are in that range, right? Well, 16 to 34, but they're actually, because my son is 16 to 34. We see that there's this slow sense of developing that sense of self, what you believe, what your worth is, what your efficacy is, so on and so forth. And I think that this generation really lacks that because, and this is a component of the phone, but not totally related to the phone and the internet and to technology, but I think the internet and technology and all that, it's designed to tell you what you're missing so you'll click it. And that creates a problem, particularly through your developmental period. Your developmental period, you're like, well, I'm not sure who I am, right? Remember, we all did stupid stuff when we were growing up, right? And we learned a lot from it and things like that. But hopefully we had people that supported us and we could push back on those things. Well, I mean, fortunately for me, the dumb stuff I did was stayed in my neighborhood. Didn't go around school or anything like that. I mean, never did anything that bad, but but now it's viral, right? And so it's a problem. And so it becomes this issue, this challenge to a concept of self. And I think we're seeing that. And that, I believe, is a pretty critical factor to this development of depression where it's fair and poor in regards to their mental health. And it's not just depression here, we're talking about overall mental health for this 18 to 34. Because look how it changes. I mean, it's pretty stark change when we look at 35 and older. We see that it drops significantly. That tells us a lot. That tells us that for people that are in that age range, 34 and under, they need coping strategies. They need experiences that give them a sense of self so they can combat mental health issues. All of us have had some type of mental health issues. It depends on how we define mental health issues. Thank you for asking. But mental health issues could be, right? I don't know. We endure a breakup. How do you manage the breakup? Do you, typical, right? Do we blame ourselves? Do we blame the partner? Do we blame friends? I mean, how do we deal with it, right? And, back in the 80s when I was growing up, we dealt with it differently, right? I mean, we had great music, so we just listened to music. But in all seriousness, that there were other things, what friends you could connect with. And they have these resources, but they may not be accessing them. And after COVID, friendships, at least I have found in my clients, and as I've, paid attention to my friends and their kids and so on and so forth, we see that they struggle with friendships because it's this internalized belief. One mistake, I'm going to write you off. Now, I don't know if that counts as cancel culture because I'm 53, so maybe I don't understand what that is, but that sounds like cancel culture to me. You make one mistake, you're out. Well, what happens is you keep cutting everybody out because everybody makes mistakes. You're not very forgiving. You're not forgiving on yourself. You end up with a pretty depleted interpersonal circle and you end up feeling alone. So on and so forth. And it gets really complicated, really complicated. All right. I mean, we can talk about household income, and as you see, right, that, the less you make, the greater the degree of mental health issues. Is that always directly related to income? No, SES is certainly a factor, and we absolutely know that. So it's something we have to be aware. We have to pay attention to. So is it us? Well, let's see. I don't know. Let's find out. U.S. adults reported visits with mental health professionals. This is, we're looking at age and gender, right? Now, this is November to December of 22. Percentages of U.S. adults who report they have visited psychologists, therapists, psychiatrists, or some other mental health professional in the last 12 months. That is critical because a lot of primary care physicians that I talk to, that I'm friendly with, whatever it may be, they are overloaded. They are overloaded because they're managing mental health. And they may not necessarily have enough training because you see a depressive symptom, you say, oh, major depressive disorder. Whoa. No, that isn't true. So what happens is their sense of being overwhelmed, they're making determinations and then they're prescribing medication. Fine. What I have found that, and my doctor, and I've been with them forever, that they have an LPC in-house. If they identify mental health conditions, they refer them to the LPC to work with them before they will do medication. Now, in some cases, obviously, in extreme cases, so on and so forth, then obviously that goes out the window, right? That changes. And it's really cool. Like, as a mental health provider, talk to your primary care physician about how they deal with it. How do you deal with mental health? Because they're overloaded. They're overwhelmed. They're overburdened with dealing with this on top of everything else. So it's really important for us to be aware of that. And I think that, for us as specialists in this field, we have to recognize that we have to reach out in our communities in order to provide different types of services as best we can. Sometimes it's great because they can give you different resources, right? And it can increase your practice if you want, or whatever. If you want that, not everybody does. I work with, a number of folks who are like, nope, I'm good, right? And I get it. I'm busting at the seams, right? I can't take any more new people either. And so you get what I'm saying. But we have to recognize that what's going on in our community. And I think that the physicians, we need to recognize that they're overwhelmed. So let's just take a look at this real quick. We see, right, 18 to 34, that range that we've talked about, right? Highest level of seeing psychologists, therapists, psychiatrists, or another type of mental health professional. That is critical. Also, mental health professional. That is critical as well. That means somebody who is licensed, somebody who has a degree. That is critical as well, because it's fine if there are things out there that want to help people improve their lifestyle. That's all well and good. But when we talk about severe issues where people could be taking their lives or the lives of others and impacting the lives of their children and family and so on and so forth, that's when things change. And I think that some folks that are out there who are working with more of a lifestyle focus need to be aware of that. Okay, I'm not going to get on that soapbox anymore. Just don't ever. But look at that, 18 to 34. That means we have a generation coming up that recognize that you're going to need to go and see a therapist. You're going to, but that they're opener. How you like that? They're more open to the idea of seeing a therapist, and that is important. That is important for us to be aware of. That tells us that we're not getting as many people in our office that are like, oh, I don't want to be here. Actually, I really find the opposite of that is that they're raring to go. They're like, yeah, I got this problem and that problem, and this is going on, and what can I do with this, and how do I handle that? So they're open to it. That is incredible, because me, when I was coming up in the 80s, there's only so much that Motley Crue can do for you. That's a band from the 80s. But you got to recognize that sometimes you're going to need help. Sometimes you're going to need assistance. But in the 80s, nobody, I didn't know of anybody who went to a therapist. And I had a friend, and her mom was a therapist. And I remember thinking, wow, that's kind of neat, because it's what I wanted to do since I was 7. So I was like, oh, that was pretty cool. All right, we don't have to get into that about why I wanted to do that at 7, because, changes the whole scope. No, okay. All right. So women and men. Now look at that breakdown. It's not really as disparate as we might have thought. Right. So we're recognizing that men are becoming more open to the idea of therapy, utilizing a therapeutic approach to strategies, managing and coping. And that is really, really important. And that women continue to stay very cognizant of the benefits of mental health, and that's great. And again, with the generation coming up, they are open to it as well.